Cancer update. So, yeah, it's been a long time since I've done a cancer update because there's not been really anything to tell you, if I'm honest. So tomorrow I have my first CT scan since having my orchiectomy. So they're going to be scanning and checking that the mass that was found next to my Viva cava has dissipated. Last blood test, there was no markers present. There was a couple levels that were a little bit off, just generally. Things like folate was off, my iron was a bit off, and I can't remember what else. But yeah, I'm going to get all that checked out shortly, hopefully. I'm going to speak to my oncologist and find out when I'm next due to see them, because I don't seem to have an appointment booked with them at the moment. So there's also a couple of other things I want to discuss with them, like a testosterone test and the hearing test. So the testosterone, obviously, that potentially could change because I've now had one of my testes removed. And it was at a normal range beforehand, but I've not had, at least I don't believe I've had, another testosterone check since then. The hearing test, so before you start chemo, they check your hearing because some of the chemotherapy can cause hearing issues and degrade your hearing. So you should really be getting a test after you've finished with your chemo, just to make sure that it's not affected your hearing, and if it has, then obviously to rectify that. I already had a slight hearing issue. I couldn't hear certain frequencies. But I just want to see if it's got any worse or any better. I don't really know, but we'll see. So yeah, I will update you again tomorrow after I've been to the appointment and let you know how that went. I won't imagine I'll have any results tomorrow, but that'll be a third video, I suppose. So anyway, you take care, guys. That's it for now, and I'll see you all soon. Take care. Much love.